Hello, my name is Catherine Seidel. I'm a certified functional medicine practitioner NP, and today I'm doing that video to talk about stool. I'm going to try to keep it short, but this is my favorite subject. So why did I choose to talk about stool? Because this is something that we can all participate in. Yes, you heard me. We can all participate in knowing about our stool. So a lot of people, when they go to the bathroom, they never look at it. They don't know what it looked like. They don't know what colors. They don't know if it floats. They don't know if it's a morsel. They can sometimes tell you if it was hard to pass or not and the frequency. So that's a huge issue, because if you look at the animal kingdom, a cat and a dog, when they defecate, they turn around and they look at it. And they know instinctively that this is important, because you have to figure out if you have certain things, like even parasite. So you should not be waited that a provider asks you for a stool test to look at your stool. So let's say what a normal stool should look like. A normal stool should be one morsel. It should be kind of chocolate brown, but not dark brown, more milky. It should have no pebble in it. No, you cannot see any food that's undigested, like a piece of tomato, because otherwise it says that you have some kind of malabsorption and you cannot break down your food, and probably you can't emulsify certain thing to break down that food. When you pass the stool, it should sink to the bottom of the toilet. It should not float. And if it floats and it's kind of greasy, or you leave grease, and you know that you're not digesting your grease, which is another issue, because if you're passing that nutrition, you're not absorbing it. If it's light brown, like almost kind of a yellow or a beige, then it also can be a problem. Even if you don't see it floating, it can be also a problem of bile acid, so you don't have enough to break down the fat. And some of the stuff that you can see, that means you haven't digested it, that means you haven't gotten the nutrition. Because you can eat very good food, but if you don't break it down and bacteria eat it in your gut, instead you have a chance to eat it, that's an issue. So when I talk about stool, I also talk about symptoms of abdominal issues, such as abdominal cramping, abdominal pain, abdominal bloating, flatulence, which means, even burping or farting. So you have to look at all of this, because it tells me a lot about what's going on in a person's body. Constipation can be accumulated over the years. It can be due to a lack of good nutrition, enough fiber, enough water, also sometimes just an hygiene of life, and that when that perpetuate, people then end up having chronic constipation, also a lack of physical activity. It can also be a disease process, such as low thyroid function. So it can be, and it can be other things. I'm not going to go and cite every differential diagnosis for what can cause constipation, but it can be quite a bit. So my role is to be a detective along with that person that's looking at their stool and describe it to me, to see what is the cause, and then of course testing. Let's go into diarrhea a little bit, because I forgot to say, constipation, why don't you want to be constipated? $1 million question. And the $1 million question is because when you're not pooping, the toxin that is supposed to be packaged out with that stool is reabsorbed in the colon and goes back in your body. So people are becoming in sort very toxic, and they tell you, I have bad breath, I have bad breath, skin eruption, my stool of course smell horrific, I can barely stay in the room. So they tell you all those things, so you know that often they are toxic. So but people that have had a diarrhea, it's another issue. Diarrhea rob you of nutrition, electrolyte, can make you tired. It's almost like when you're vomiting, except one is a different of an acidity issue. But anyway, so when people have diarrhea, it's qualified as stool that are loose, liquid, and I don't think that frequency is really not that big deal. Some medical books say 5 times a day, but I've seen people that seems to empty their colon in one bowel movement, and they are totally empty, and they fill up the toilet, and this is the way they almost function all the time. And there is name for those diseases, because some people, call it IBS, but that's just a blanket term for something bigger going on usually, and you have to be a detective and looking for it. So people have diarrhea. Often it can be caused by stress. Stress is a very typical mechanism of the body to dump the stool when you are stressed. And the reason is because the sympathetic nervous system take over when you are stressed. The bear is chasing you and the body dump the stool so it can shunt all the blood to more vital part of your body, like your hands and your feet, so you can get away. Of course, diarrhea can happen with food poisoning, very normal processes, and it happens with something that's called SIBO. So a lot of my patients have SIBO, and I really want you to walk away from this, that if you have a long-standing condition that's causing you any of the symptoms I described of abdominal symptom, it can be caused by SIBO. So SIBO happens in the small intestine. It's basically you have bacteria that are eating the food that you should be eating, and they are over festering on that food, and they are overgrowing on that food. So how do we test for that? So those bacteria, their way to poop inside of you is to create a gas. It's one or two gas that we can test for now. It's either hydrogen or methane. Hydrogen has tendency to cause constant diarrhea, and methane constipation, but sometimes people also can have both. So sometimes they're constipated and sometimes they have diarrhea, so it can go back and forth. So on the subject of stool, I hope you learned a lot. There's a lot of testing that can be done, but there's also things that you can just add to your diet to help you digest better. But that often has to be done with the supervision of a provider that knows what they are doing. But just with the stool, we can do a lot. I have a web practice, and if you're interested in knowing more, and if you have any of those issues and you would like to talk further, I'll attach my contact to this video, and I would love to help you. Thank you.